Hi everybody, my name is Alex Javrankov and I'm the founder and CEO of Insilico Medicine. So welcome to our target discovery group. I am broadcasting this from our headquarters where the target discovery group is located. And I want to give you a small short intro into target sciences and emphasize the importance of identification of protein targets and mechanisms of disease. So this is perhaps the most important, crucial point in drug discovery and it's the start of the journey. Most often it happens in academia where scientists with deep knowledge of disease hypothesize about which proteins or which pathways are driving the disease and that could be perturbed using different therapeutic approaches, including small molecules, antibodies, etc., in order to modulate the disease progression and perhaps even stop the disease or even reverse the damage caused by the disease. So this process usually is very lengthy. It involves decades of research and billions of dollars of taxpayer money in the form of government grants. And there are very few good targets out there. That's why the pharmaceutical companies are trying to go after the most popular, validated targets that have established evidence of working. And that's a very crowded space, so everybody is trying to go after the same targets. So how do we go around that and find novel mechanisms, novel targets, and more effective therapeutics in order to modulate the disease and hopefully aging as well. And that's actually why we started Insilico. So when we started Insilico in 2013, 2014, we were predominantly focused on target sciences, target ID. We were using predominantly biological data types such as gene expression, protein expression, genomic data, mining massive data sets to identify traces of evidence that the specific protein would be implicated in a specific disease, predominantly focusing on cancer. We were working predominantly on grouping genes and proteins and methylation data into networks, pathways, and looking at the differential state change of those networks between norm and disease, human tissue and animal tissue, young, middle-aged, old, and very old individuals, and formulating many hypotheses about which proteins might be more important in a specific biological process. Later, we started training deep neural networks on those pathways and started training deep neural networks to identify a variety of pathways and targets that are driving the disease. And then we went into generative approaches and transformer models that allow us to pick the targets that are more novel and have additional sources of evidence being implicated in a disease. We also collaborated with a very large number of pharmaceutical companies, acquiring knowledge over the years. So now we have been around for almost 10 years and collaborated with pretty much every expert pharmaceutical and biotechnology company out there. We also developed our own automated facility that replicates many human models with different organoid systems and even primary tissue that allows you to validate target hypothesis in a fully automated robotics-driven way. And we currently have a system in place that is driven by our AI target discovery platforms. So in the course of the following lectures, you're going to learn the general principles of drug discovery presented to you by people who are actually expert in target sciences, who are discovering targets as their main job, using AI and also helping develop better artificial intelligence for target picking. So people who are going to be presenting to you today, they've been working for Insilico for a very long time and they have battle tested many of those algorithms either with academic collaborators or pharmaceutical companies or using internal pipeline assets.
Hello everyone, welcome to the Target Discovery course. My name is Frank. Today I'm going to talk about the target selection criteria, which is very important in the target discovery process.
Welcome to our educational course on disease modeling and target discovery. In today's fast-paced biomedical research landscape, disease modeling and target discovery are critical areas that require cutting-edge computational and experimental approaches.
Hello, I'm Anna Gupanova, research biologist in silico medicine. In this course, I will be guiding you through the section on computational approach for drug target discovery and drug combinations. See you!
Hello everybody! In my part of the course, I'll tell you how biological networks, text data and prior knowledge could be used for computational drug target discovery.
Hi, I'm Vladimir Naumov from the In Silico Medicine, and I'm going to tell you how do we use large language models to make process of drug discovery easier and faster.
Hi everyone, in this session of class, we're going to talk about three topics. Their new frontiers of drug R&D, their synthetic lethality, drug combination for oncology and non-oncology.
Welcome to our therapeutic target discovery course. This course is specifically designed for bench biologists, mathematicians, and also pharmaceutical experts. Please join us at this exciting adventure to the world of novel and existing therapeutic targets. Let's get it started.
Called PandaOmics. It is very accessible to academics and the industry. We're not charging much of it and providing free access for people who are interested in trying it out. And very often even a trial period is enough to identify very useful targets. You are going to see how we can implicate the many targets in a variety of diseases from scratch or from literature. So either from biological data or from literature data, you're going to use transformer models that we have developed and also hooked it up to conversational models that allow you to converse with PandaOmics knowledge graphs, either coming from a priori biological data or from text mining. And you are going to see how we can utilize PandaOmics and other tools that we've developed at In Silico to run fully robotics-enabled experiments for target discovery and target validation. So I welcome you to try In Silico Medicine's PandaOmics tools. We also have a tool called InClinico, which incorporates a lot of valuable target discovery philosophies as well, that allows you to predict phase 2 to phase 3 transitions. And we welcome you to do either an internship at In Silico or co-publish, collaborate. We're extremely collaborative. And welcome to our Target Sciences course.